Welcome to Let Go, Let EFT, where we are learning and leaning in with you, with your hosts Michelle Puster and Dr. Laura Spiller. EFT is a beautiful model helping people connect with themselves and the people that matter the most, developed by Dr. Sue Johnson.
Hello, Michelle. I'm excited to start a new series.
Yes, talking about sex and couples therapy.
Yes, super needed discussion for us couples therapists to gain comfort and have, again, our EFT roadmap kind of extended into the area of sexual intimacy for our couples. And you have become an ASEX certified sex therapist, which is no small undertaking. And what an amazing compliment to your EFT certification also. Yeah, can you tell us a little bit about what led you to do that and what that experience was like?
Yes, definitely. So I was doing a live where a case consult at one of the trainings where a trainer came to Houston to, and I presented my couple and blah, blah, blah. And the trainer was like, well, tell me about their sexual relationship. And I was like, well, the first session or two, I might have asked about that. I think they said this, and now it's like a year later. And he's like, well, you need to ask about their sexual relationship. You need to know what's going on. That can be, very informative. That can be a strength, or it can be adding injury to their relationship. And I was like, it was just very embarrassing. It was very embarrassing. And I know that I'm not alone. So at that moment, I was like, I am going to talk to my couples about their sexual relationship. I'm going to set this intention. And you know what? Not a lot happened. It was pretty much the same. And I was at some point, I thought, you know what? I don't know what else to do to push myself to talk to couples about their sexual relationship other than create my own, education, awareness, and deal with my discomfort, deal with my like enormous amount of discomfort. And so I was like, you know what? I'm just gonna dive in head first and I'm really glad I did. I've learned so much, like things that I didn't know I was going to learn. I continue to keep learning. And so it's fun, and the reality of it being hard for us couples therapists to talk about our couples sexual relationships with them is very real. So any of you out there, you're not alone. You're not alone.
Well, I
Def-
relate to that so much. I had a couple I'd been working with for about a year, and we had made a lot of progress. And I, finally asked about the sexual relationship, and they were like, "Oh, we thought that, that wasn't something that we were covering and talking about in couples therapy." And it was another one of those aha, like, "Oh my God, how could I have let them think that that's not something that, we're talking about?" And it was because we weren't talking about it.
Right. There's kind of a joke that I think maybe Mike and Zoya made in their training, which is, now that you've done this training, your couples on Monday are going to be telling you a whole bunch of things about their sexual relationship with, and it's because we have so much discomfort. It's kind of like we're sending inadvertently, possibly sending the signal.
Mhm.
Sex isn't something we talk about. It's not something I'm comfortable with. It's not something to bring up. And somehow, even just our going through trainings ourselves kind of lowers that barrier. And couples, we're sending the green light signal, right? It's just this subconscious thing that kind of shifts and changes. So maybe we should talk about what it is that makes it, what are some of the things that we've found that make it the most difficult for couples therapists to talk about sexual relationships?
Well, as you say, right, I think, yeah, I mean, we all have our discomfort with that. Yeah, I took the Mike and Zoya sex as a safe adventure training too, and they even talked about like micro expressions that therapists can have that can send a dampening message. If your eyes tighten up and your jaw tightens up. So just, and we're both talking to you from Houston, Texas. So we are maybe a little bit affected by Southern culture too. Where there's religiosity in our community too, that either can impact our comfort with talking about it, And I also know that my clients are so uncomfortable. So it's hard to pull them into a conversation where you know that they are going to be, just squirming and unsure. And it will bring up anxiety for them. So that's hard for me too, to handle mine as well as theirs.
Yes, yes. And I feel like that's where we have to start with ours first, right? Like, something I was thinking about is many of us never had a conversation with our parents about sex, about sexual relationships, about, maybe even cycles and what to expect with menstruation. I mean, we might have been handed a pamphlet, maybe so the like we didn't get this information in school, likely. We didn't so often get it from our parents. We didn't get it in our education as therapists. So we're really at a disadvantage. And that also sends us the signal, as culture does, it's taboo. And then that leaves us with a really big problem, which is we don't maybe have the education ourselves unless we've gone and sought it out. And then we go off of bias, our own personal experience, what we see in the media, which is, all kinds of upside down, or, maybe porn, or like we're informed, like many of our clients, in by media that's just wrong, right? We're
Right. Yeah.
getting misinformation, and then if we don't have those other like correct information from, good sources, then we may bring our own bias into the room when people bring up their concerns and when they bring up any number of different kinds of topics. And so then that's also a potential disservice that we're doing to our clients, moving from our own bias, our personal experience, rather than meeting them where they are with knowledge about, being able to normalize that and what couples can expect.
Yeah, and I even wonder, are there things that are difficult talking about sex or working with sex for therapists who might have more comfort talking about sex, who, may not, be of my generation where, where maybe, and I mean, I know that my young adult kids are just so much more comfortable talking about it, which has been a blessing and helped me also, um, you know, have more of those conversations with people I care about. Um, but I think, I wonder if you're really comfortable, maybe it is harder to understand the discomfort of your client. Or, I mean, I almost wonder sometimes if we might experience, more alliance with one partner. I mean, we still have some of those same challenges, more alliance with one partner of the other, or kind of the um inner, oh, I hate to use the word judgment because we're, EFT therapists, we are so compassionate and tolerant, but I mean, we can't help but have sometimes negative reactions. I was just talking to a supervisee who in general is very comfortable talking about sex, but she's working with a client where, the sexual behavior of one partner is something she's not familiar with, that she feels uncomfortable with, and so she's is grappling with some of these same things, even though generally sex doesn't feel as taboo to talk about as her. So I think we as therapists, are on a spectrum of comfort, but there are challenges on with working with sex and EFT at all, kind of all places in that on that continuum.
Right. Yes. And there are ways that we can work with that, like I went through the sex therapy training, but I was so excited to do Mike and Zoya's training because I wanted to hear about sex therapy from the EFT lens. And that training is designed not for sex therapists, it's designed for couples EFT therapists. And they do a great job of demonstrating can just be another topic. Yes, there are so many things within that we really maybe do need specialized education. And even for me, there's things I'm going to refer out to that I don't have that particular area of knowledge. That's not my expertise or specialty. So no matter what, there's times we may need to refer to a specific sex therapist or refer to a sex therapist. And there can be lots of space to talk about the emotional impact of, let's say, desire discrepancy. That's one of the biggest reasons that people seek sex therapy, where one person has a high desire and one person has a lower desire, and there's this mismatch.
Mhm.
And that can create a lot of pain, frustration, resentment. And oftentimes, couples have been dealing with this for years. And so we can lean in with the emotional impact that's happening for both of them. And like you were saying earlier, that is one where if we are more of a responsive desire, which we'll talk about that maybe next time in our series, the responsive desire versus spontaneous desire. But if we're more of a spontaneous desire person, we might align more with that person. If we're more of a responsive desire person, we might align more with that person. And we might have judgment about why is it that you feel like this, or why don't you want more of this? And so, yes, that's when our personal experience, without having other kinds of experience and knowledge about that, may really weigh heavily into like what feelings come up for us in the room.
Totally. Well, I like that you're saying that, you know, one, there's a lot that we can do to help couples become more sexually intimate and feel closer in their sexuality with one another. And, there are going to be times where we're going to want to consult or refer out because there's, nobody can be the expert in all areas of, human human sexuality. Um, but yeah, that there's especially with, there are common presentations where couples can get tripped up in their sexual intimacy, and that we can use our EFT skills to help them slow down, kind of see how their cycle relates, how their cycle is coming up in this realm or how it might be different, help them access the emotion, which really, again, is driving all the ways that they've dealt with it and talked about it that's not vulnerable. uh,
Right.
and help them communicate more clearly, understand each other better, have compassion for one another. There's so much that we can do from our EFT model to be able to help couples.
Right. It's kind of silly to say this, but it was this huge aha when I was like, oh, so I'm going to keep doing EFT therapy generally, if someone's seeking sex therapy, and just talking about sex, right? Maybe we're talking
Ah,
like, duh. But it was
oh,
really kind of a relief. Like, oh, I know how to do this. Now we're just talking about, maybe we're talking about desire discrepancy. We're talking about how you initiate. We're talking about specific sexual, what happens during intercourse, because it's all the same. Like, he put his hand there and I thought it meant this and he thought it meant that. And then this happened. Oh, well, that's interesting. So you each had your own idea in your head, and you didn't really know what was happening with the other, and that gave you all these kind of bad feelings, and then this happened. It's like it's kind of a relief and an aha moment. And like you said, we have so many skills. We have these skills already, right, as EFT therapists, to help people communicate clearly and lean into the difficult conversations and help them understand how they're feeling. We get to understand how they're feeling. They get to share with their partner. And now we're talking about specific topic of their sexual relationship, and maybe sometimes even the nuts and bolts of their sexual relationship.
so helpful for us as therapists, for the clients. I mean, yes, incredibly helpful. And any, you mentioned desire discrepancy. Are there other kind of common things that couples present with that you think are especially, helpful for EFT therapists?
Well, another is couples kind of we all likely have a sexual script that's based on our expectations around what we're going to think our sexual relationship's going to be like. And that might work until it doesn't, until someone's body changes, like they go through menopause, or someone's aging and their body is changing. Maybe they don't experience erections in the same way. Maybe they have some kind of health experience where their body is changed, and or so sex doesn't look the same, and or pregnancy, during pregnancy, after pregnancy, endometriosis. Like there's so many things that change the sexual experience, and it creates so much it can create so much pain and distress for both people because they have an idea of what it's supposed to look like, what they're supposed to experience, and so there that be dynamic, which is normal. Like I love that Emily Nagoski talks about in her book Come Together. If you're in a long-term sexual relationship, you're gonna experience changes in your body that are gonna impact your sexual relationship. So better be able to talk about it early on and talk about what's happening and talk about those expectations and maybe even let a lot of the not so great ones go. And like she says, pleasure is the measure. Focus on having a pleasurable, positive experience for both people. Another one I would say is people experiencing pressure and
Mm.
to have sex when they don't want to. So then it creates this dynamic of obligatory sex and
Sexual death spiral or uh
yes, and that's a great sad name for it. And
yeah,
and what
yeah, that's kind of extreme, but I've heard it
yes, but it's
described as
true.
that.
I think it can be true. It can be true, right? But especially for couples that have been experiencing this for years. And the other partner that maybe early in the relationship was often the pursuer sexually will start to express like my partner is there just there out of obligation. I'm not even sure they want to be there. I don't know that they like being sexual with me. I don't feel wanted. It just feels like they're checking something off the to-do list. So that dynamic, it really is painful and harmful for both people in the couple and often starts early in the relationship. And one thing that we know is that you're having sex that you don't want to have lowers your desire. So if a couple gets stuck in that pattern that keeps happening over time, then you're going to experience less and less desire, right? And it's about someone else's pleasure, not about there's all these dynamics. So again, we zoom out and we just kind of sit in the pain of how did that get to be the pattern? What was that? How is it like for you now that this has become the pattern? And we're trying not to, again, judge, trying not to say, okay, well, this is what it needs to look like. This is where you need to get to, you know? No, I don't know where they're going to go. I love that Micah and Zoya said that. Like, we don't know we don't have this. Okay, so the goal is like they're going to be having sex once a week and this is what it's going to be like. And both people are going to be having orgasms. No, that's the script, right? That's what we're trying to step away from. We don't know what their positive outcome is going to look like. We're going to let them figure out where they're going and we're going to start with, oh, this sounds like a really painful place that you're in. Let's start there.
Just appreciate if they're able to talk about this, which I think so often the blocks to vulnerability that we see in the typical cycle, I mean, operate here too, so that people aren't turning towards and trying to sort it out together. They're kind of, turning away or turning inward with some of the pain and the challenge. So if we can just even get them talking about it, they're going to be able to have shared meaning and co-create kind of this other vision of what their intimacy looks like. I mean, that sounds like so amazing. And
Yes,
tools that we as EFT therapists have. Um,
right. Yes.
so this is our intro to our series. We're kind of just setting the stage here.
Mhm.
Some of the other episodes that we're talking, planning for this series. I know the first one we're going to talk about sexual history and assessment. What are some other topics that you want us to talk about, Michelle, in this series?
The desire discrepancy, responsive versus spontaneous desire, because often that's such a enlightening experience. We may also touch on when to refer out, so you kind of have some comfort around like, okay, this is a space where I can keep going, and like once you hit a roadblock, okay, this is when I can refer out, or like you mentioned, I can consult with a sex therapist, so I have a better idea of how to work with this couple. Um, and then
I'd
we're
love,
gonna go ahead.
go ahead. I was thinking I'd love to talk about like sensate focus and some of those other typical sex therapy interventions and how they fit into EFT. That might be kind of maybe towards the latter part of the series, but I think that that would be a great one to talk about. Uh,
Yeah, and so that's what we're gonna try to do is talk about maybe some high level sex therapy interventions and how to put the EFT lens on them, and basically the kind of couples that we would be able to work with as EFT therapists if we're not sex therapists, right? And yeah, maybe we could talk about some takeaways. One of the ones that I'm thinking about is how, if you know that you're like me starting off, well, how could you create more comfort in talking about sex with your couples? And some ideas that I have is get a friend, get another EFT friend, and talk about, how uncomfortable it is to talk about sex. What makes it uncomfortable for you? What kind of messages did you get around sex? And what are you afraid of if you talk to couples about their sexual relationship? And doing that with a peer is just, it's you stepping into that discomfort. That's you talking about it in a safe place. You might also talk about it with an EFT supervisor. You could talk about it. Maybe you want to do a consult with a sex therapist. There start Another one would be get some education, right? Emily Nagoski has several great books, Come As You Are. Now she has Come Together. I would also encourage you to check out Mike and Zoya's training, or Dr. Laurie Watson and George Fowler also have a sex therapy and EFT training. They have a podcast. So there's lots of places.
Yeah. Lisa Blum and Silvina Irwin have a sexuality and EFT training also, and we'll list those in the show notes so that you can see some of the EFT trainings that are available for therapists and to learn more about sexuality. I think that's a great idea.
And the last one that you said when we were getting ready to do this was the EFT. We have these skills. So can you maybe leave us off with that?
Yeah, so while we do need to increase our knowledge and develop our comfort, we also need to realize that, we have a lot of important skills that are going to help our couples. We don't have to do anything other than what we've been doing, good EFT therapy, to help slow them down, take some risks in revealing their inner world about the sexual issues and the sexual delights in their relationship, and help them talk about that and connect with more compassion for themselves, more compassion for each other. And I think we'll be amazed at the movement that they have, if we're bringing those traditional EFT skills to this part of their relationship.
Yeah. Yeah. Well, thank you for having this discussion with us, and we would love for you to drop us a line if there's something that you want us to talk about or a question that you all have that maybe has come up for you. And we have loved all of your comments, that we've been reading them, and it really does encourage us to keep making these recordings. And thanks for being patient with us about, the space in between. We love hearing from you guys. Thank you.
They're very motivating to be more consistent, even though, we're doing this for fun and squeezing it into those the little bit of time here and there, but it's super meaningful, especially when we hear that it's helpful. So thank you so much, and we will see you again soon. Thanks.
Bye, guys.